Hello from sunny Phoenix, Arizona. I'm here for a week on business, and I'm going around and just thinking about various economic things. In this day and age, one of our big concerns is healthcare in America. Some say we need to make sure that everybody has health insurance. Well, I'm thinking that maybe that's not necessarily the right way to go. The problem with health insurance is that if everybody has health insurance, we'll have very healthy insurance. And insurance is not concerned about your health, they're more concerned about their health, their financial health. And they also need to make a profit, and they're a big cost in the middle. The other aspect is that people say you need insurance because health care just costs too much, and nobody could afford it otherwise. So we have health insurance, and plans are evolving over time to address how do we pay for the health care. The health care inflation is out there. It's inflating at a great rate. So they say you need to have health insurance to cover this inflation. But I'm thinking, well, all we're doing is addressing the symptoms, the inflation. How do we pay it? How do we keep on paying it? And nobody's addressing the cause. They're looking at the symptom and not the cause. If you fix the cause of the inflation and fix the cause of the high prices and high costs, you will get better results. So I think they need to do more looking at that. The other part is that it's inconsistent coverage. People who have wealthy employers have better health insurance than those who do not have wealthy employers, or those who are unemployed, or people who are old and retired. It's a total mix of everything. This means that for the healthcare providers, there's a huge, complicated administrative burden to handle all these different permutations of patients and insurances, and who gets paid what, and fees, and some providers have many different agencies underneath them, and some cover and some don't. This simply means it's a very complicated administrative financial mess. So some people are proposing single payer health care. This basically says no insurance, all the health care is just paid through the government, through a certain way of like a health agency. And where does all that money come from to pay for it? It would come through taxes. We already pay a Medicare tax, so it would just simply increase the Medicare tax a little bit. On the other hand, you wouldn't have to be paying insurance premiums to wealthy insurance companies. And in that case, towards business, are you listening, business? This takes that health insurance burden off your bottom line, and it actually puts more money in your pocket. Gives you more money to work with and makes you more competitive in the world. So, getting rid of health insurance is both good for the patient and good for the employers. It does add a little more taxes though. But then again, the employee doesn't have the insurance premiums, and the company who pays probably 3/4 or 90% of the insurance has that added directly to their bottom line. The second part of this then is they'll say, well, what about places like Canada? Their health care is like, well, that's probably based on some of the propaganda that we've been hearing, and some of it may be true. You may be able to get some very cheap medications from Canada because they control, by means of economies of scale, all the medications coming in. But if you need a transplant or an operation, they are in shortage of surgeons, and so you have to get into a waiting line, which usually takes longer than your lifetime. These shortages, these long waits, are a result of the design by the government. If we want to have an American system that works, and we know about this already, we just have to design it right the first place. Not design a dysfunctional, screwed up system. We have to design a system that works. A system that makes Americans healthy. That is my thinking of the day. Also, on the provider side, there would be more incentive for them if they were told that a broken arm, you'll get $300. Fix it. And if you don't fix it right, you're going to have to fix it again and no extra money. Then there's incentive for them to do it right and do it right the first time. Not just come back again and hit you for more and more bills. That's not the right way of doing health. The right way to do health is to fix it and fix it right the first time. That would be an incentive on the providers to provide cost-effective health care and health-effective health care. So, those are my passing thoughts on health care for today. Be seeing ya!